Beautiful stuff outside. Hey, this is the time of the year when we start thinking about heart health, heart attacks. We have Dr. Igbokidi.
You did.
I got it.
You did it.
Great to have, she's a cardiologist. I can't talk at all today. It's not just your last name. But at CHI St. Vincent in Hot Springs here to share some of the symptoms people should be aware of when you may be having a heart attack. Thank you so much for coming on the show.
Thanks, Todd, for
What are some of the symptoms that people usually exhibit?
Absolutely. So it's you can never understate the symptoms of a heart attack. It's important to get in early, take care of the patients quickly, and part of that is the patient actually identifying that they're having symptoms. Mostly people have chest discomfort, and it's usually substernal in the center of the chest, but it could be to the left or to the right of the chest. And most patients would have experienced some element of symptoms, but not all. It could be a first-time onset with symptoms, and it may radiate up to your neck, down your arm. And sometimes patients have associated shortness of breath or feel like sweaty and nauseated. So, and it's really key to immediately call 911 if you have those symptoms.
Is it different, some of the symptoms for men versus women?
Well, usually most patients will present with chest discomfort. That's a really good question because women fall into the category, and women and diabetics who can have unusual symptoms where they just may feel really short of breath and have jaw pain. I had a patient once who went to the dentist because he kept having jaw pain and was in the dental chair trying to get his his tooth pulled out, and it ended up being that he was having a really bad heart attack.
Wow.
And obviously that can be some of the atypical symptoms.
But sometimes people have a sharp pain in their chest and it's not a heart attack, and sometimes those symptoms are misidentified.
Sure. So what I always tell my patients and everyone is, if you have any symptoms that are new, persistent, unusual, you should obviously talk about it with your care provider. But heart pain can be sharp, but if you have a pain that if you moved your chest or you lifted your arm and you hurt, is more likely to be musculoskeletal. But I mean, you wouldn't do wrong talking about it with your physician. There
are some, we talk about the obvious symptoms, but there are some that are not so obvious to everybody that are kind of surprising to some people too.
Like fatigue.
Fatigue.
We might not be as presenting with a heart attack as much as just having angina, symptoms of a blockage in the heart artery. Now, not if you did a lot of work and felt tired, but you have unusual fatigue, swelling in your lower extremities. Those could be symptoms of angina or atherosclerotic disease with blockage in the heart arteries.
Unusual fatigue, I guess, because you're not getting the oxygen.
You're not, absolutely.
And so that causes the fatigue. Very
absolutely.
Interesting. Yeah. So I'm like most guys, and even my wife too. We don't want to go. No offense. We don't want to go to the doctor's office. That's the last place we all want to go, and you had the stuff checked out. But what can we do to prevent heart attacks? So
knowing your risk factors is really important. So if a patient has high blood pressure, diabetes, high cholesterol, family history of early onset heart disease. So if you have a family member, first-degree relative who's had a heart attack at a relatively younger age, and treating those risk factors. I mean, obviously, a lot of people when they're younger find it difficult to have to take a medication regularly, but I think that doing that early and taking care of those risk factors will certainly reduce your risk of presenting with an acute cardiac event.
What about taking an aspirin a day? What about that?
So that has been very well studied. Not every patient should take an aspirin a day. So you have, it depends on your risk panel, because aspirin is a thinner and there is a risk of bleeding. So there's certain patients who will benefit from a daily aspirin, and that's something that they need to discuss with the care providers.
So don't just start doing that. Talk to your doctor.
That is right.
All right, thank you so much. We want to make sure we give get everybody out there information about the Heart Ball that's coming up, the 2015 Heart Ball, appropriately on Valentine's Day at the Hot Springs Convention Center. Tickets are $125. For more information for this great event in Hot Springs, CHIStVincent.com/Hot Springs Heart Ball, or you can just give them a call. I'm sure that they'll be able to get you in touch with somebody.
Exciting, very exciting time.
You gonna be there?
I am gonna be there, and we are the presenting sponsor. CHI St. Vincent is. Everyone should support the Heart Ball. It's for a good cause, and for the American Heart Association. It's a great social event in Hot Springs.
All right, and again, the information here for Dr. Igbokidi.
You did it.
I did it. CHI St. Vincent Vascular Center in Hot Springs, 501-625-8400 or CHIStVincent.com. Thank you so much for coming.
Thanks for having me.
Great information.